Back now at 7:30 on CBS Mornings, and we bring you a 6-month CBS News investigation that raises new questions about how effectively state medical boards can hold bad doctors accountable and thereby protect patients. This morning we hear for the first time from an insider who sits on California's medical board, which is responsible for licensing and disciplining more than 150,000 doctors. In part one of our two-part series, Chief Investigative Correspondent Jim Axelrod looks at the case of a doctor who was allowed to continue practicing despite repeated misconduct that the medical board knew about. Jim, good morning.
Good morning, Tony. In California, a board of 15 people makes these decisions about when a doctor should lose his or her license to practice. Now, 8 of the 15 are other physicians. Our investigation raised questions about who that board is protecting. The public or the doctors?
I think I was absolutely botched. There's just no other description for it.
Brandy Williams is describing a 2016 surgery she thought would help her get her confidence back. After losing almost 30 pounds, Williams decided to reward her hard work with a procedure known as an abdominoplasty, or tummy tuck.
The doctor's office is supposed to be a place of healing, and that's not what this place was for me.
My name is Jason Helliwell.
To do the surgery, Brandy chose Dr. Jason Helliwell, an OB/GYN who also conducts cosmetic procedures. He practices in this building behind me, right here in Bakersfield. But Brandy says she only chose him after first conducting her own research into his record.
I took a business card from his office, which has his medical license number on it. I went home, found out if there were any complaints against him. It was blank. There was no complaints against him.
We discovered Dr. Helliwell had been disciplined for negligence 5 years earlier.
I was in pain for 1.5 years.
According to a malpractice lawsuit, Williams settled with Dr. Helliwell. Her surgery left her with a painful hematoma that required surgical repair. Williams says that pain drove her to file a complaint about Dr. Helliwell to the California Medical Board.
It's their job to protect us from doctors who make mistakes. I'm not saying he's not human. We all make mistakes. But he made a whopping mistake when it came to me.
What could have been helpful to Williams was knowing another patient had already reported Dr. Helliwell.
It's not like I went to a car dealership and went to buy a car. This is my life.
6 weeks after delivering her child, Emily Yost says Dr. Helliwell told her she needed umbilical hernia surgery, and he could do the procedure in his office, even though Emily says it had been scheduled for the hospital.
Knowing what I know now, I would have switched doctors immediately. Okay, this is my online complaint summary.
Yost sent this complaint to the California Medical Board, explaining she had to have an additional surgery to fix the surgery that Dr. Helliwell performed.
I never got an email that said, hey, we'll look into it. We're sorry that happened. Nothing. Nothing happened.
But CBS News has learned that while the medical board dismissed Brandy Williams' complaint and never even bothered to contact Emily Yost, the California Medical Board had been investigating Dr. Helliwell the entire time. This 54-page ruling details a laundry list of misconduct by Dr. Helliwell dating back to 2013, including a sexual relationship with a patient, administering toxic dosage of lidocaine, and gross negligence in the treatment of 4 patients. Investigators concluded Helliwell's care of one patient showed a fundamental lack of knowledge. But in 2018, the California Medical Board did not revoke Dr. Helliwell's medical license. Instead, they placed him on 42 months probation, with limits on his practice. Since the medical board's ruling, Dr. Helliwell has been arrested and charged with 32 felony counts for a fraudulent medical billing scheme. His medical license in California remains active.
What does a doctor have to do in California to lose his or her license?
That is a great question. And the answer is, I don't know.
T.J. Watkins currently sits on the California Medical Board. He's speaking out for the first time.
Is the California Medical Board doing its job?
Absolutely no.
CBS News found that since 2015, the medical board received more than 50,000 complaints against doctors, yet they revoked just 201 licenses, less than 0.5%.
Do you think the way the medical board functions actually ends up costing patient lives?
There's no question that it costs patients' lives.
No question?
No question.
Dr. Hellawell declined an interview when we reached out with questions we never heard back. Now, as for the medical board, it said the law requires it to rehabilitate doctors when possible, although the board does tell us it is currently looking into the criminal allegations against Dr. Hellawell. Tomorrow, in part 2 of our investigation, you will hear more from our exclusive interview with California board member T.J. Watkins, who says the board does allow dangerous doctors to keep practicing.
I think that I'm really looking forward to hearing what Mr. Watkins has to say. I think it's extraordinary that he's still sitting on the board. He's criticizing the people that he's working with.
That's a big deal.
And in very clear and unambiguous terms, he will continue that tomorrow morning.
And speaking of ambiguity, I mean, there should be standards for practice, and when you violate those standards, your license should be revoked. But no one seems to know where the line is.
Well, a lot of this comes back to the makeup of the board. Now, remember, you have a 15-member board, majority rules, and you've got a majority of doctors. So everything sort of funnels back to that controlling premise when it comes to how does this board function.
How are the women doing, Brandy and Emily?
I mean, I think you sit with them and there's this overarching question of, wait a minute, if the board's not going to protect us, who going to protect us? So in addition to all the suffering and the trauma, there's this question of who's going to take care of us.
Looking forward to part 2.
Thanks.
No doubt about it.
Welcome back to CBS Mornings, where we're bringing you part 2 of our CBS News investigation into the California Medical Board. We sat down for an exclusive interview with an insider who says the system is costing patients their lives. Yesterday, you may recall, we introduced you to 2 patients who said they were hurt by a doctor who has already been under investigation by the board and was nonetheless allowed to continue practicing. It's a perplexing case, and our chief investigative correspondent, Jim Axelrod, has been digging into it. Perplexing and concerning.
Yeah, good morning, Tony. The stated mission of the California Medical Board is to, quote, protect healthcare consumers. But our CBS News investigative team found that doctors who repeatedly hurt their patients are often allowed to continue practicing. Today, we hear from 2 men who say the system is broken and efforts to reform it have failed for years.
I'm speaking out because I can't sleep at night.
T.J. Watkins was appointed to the California Medical Board in 2019.
You can't sleep at night because the way the board does its business?
Yes.
Watkins previously served as vice president of the California board that licenses physical therapists. He's speaking out now because he's troubled by what he's seen on the medical board.
The way they speak is always with doctor care in mind. You never hear patient care, ever. And I mean ever.
Do you think the way the medical board functions in the state of California actually ends up costing patient lives?
There's no question that it costs patients' lives.
Watkins started tracking discipline cases and says the California Medical Board handed out more lenient punishments than its guidelines suggested in 9 out of every 10 cases.
So in 90% of the cases that crossed my desk in the year 2020, we did not follow the guidelines.
CBS News analyzed the last 5 years of disciplinary decisions made by the medical board, which works hand in hand with the Attorney General's office. The board sanctioned more than 200 doctors for repeated acts of gross negligence, but allowed them to continue practicing.
Are you surprised at all?
No, not at all. Because I'm in the room. I'm in the room trying to stop that from happening.
For the last year, Watkins has been fighting to force the board to hold doctors accountable.
The process is not working for the public, but unfortunately, it's working perfectly for the doctors.
One physician member on the board chastised Watkins last month for rocking the boat.
In my 8 years on this board, I have not encountered another board member who has been so negative about our process as Mr. Watkins.
While the mission of the 15-member California Medical Board is to, quote, protect healthcare consumers, 2 of the 15 seats are occupied by former presidents of the California Medical Association, which lobbies lawmakers from its headquarters here in Sacramento on behalf of nearly 50,000 doctors in the state. Did you ever run into an opponent as fierce as the California Medical Association?
No.
Never did.
Few know more about the California Medical Association or the CMA and its lobbying power than Jerry Hill.
Their ability to bring money to the table, to bring support, all factors into their ability to control the medical board and control legislation going forward.
The former state senator chaired the committee that oversees the board and spent years of his political career trying to make the medical board more accountable.
Today I introduce the Patient Right to Know Act of 2018.
The CMA, in your view, is it a powerful organization?
Probably one of the most powerful special interests that we have here. They are masters at getting what they want from any legislation.
We analyzed the California Medical Association's political contributions and found that since 2015, they've spent nearly $15 million on lobbying and in donations to state candidates. And during Governor Newsom's recall election, CMA gave $750,000 to the California Democratic Party. The access that kind of money secures was evident when this photo surfaced during the pandemic of Governor Gavin Newsom maskless at a Napa restaurant where you can find $50,000 bottles of wine on the menu. Seated with the governor, the California Medical Association's chief lobbyist, as well as its CEO. Governor Newsom has made 5 appointments to the medical board.
Governor Newsom's office declined to comment. The medical board said the law requires it to rehabilitate doctors when possible and told us that no matter what, the board follows its mission, which is to protect patients. As for the California Medical Association, they declined an interview request but pointed out that it has fought for public health during COVID and pushed for regulations that, quote, protect patients from bad doctors.
That's a nice little twist there at the end about the California Medical Association. But I want to go back to Mr. Watkins for a second. I'm in awe of him, a current board member who's speaking out against the board. Do you think it's going to hurt his standing on the board?
You know, I asked TJ, what are you doing? Like, you know what?
What are you doing? Why are you doing?
What are the consequences here? And he grew up in South Africa during apartheid and was very clear. He said, look, his philosophy is that, you know, in his words, for evil to triumph, good men do nothing. So to be a good man, in his view, he had to stand up and talk to us. And that's what that was all about.
And for clarification, we're not talking about small botched procedures. Like sometimes these come to fatal endings for these patients.
Yes, and then the investigations ensue and people...
These doctors continue to practice.
Absolutely.
If I'm a patient this morning, I'm not feeling great in California, knowing that my board that's supposed to protect me has lobbyists and doctors on it.
The right millions of reasons why this system will continue, as you saw at the end.
I think that might change, though. Thank you, Mr. Watkins, who said he couldn't sleep at night. Thank you, Jim Axelrod.